स्वच्छ भारत का इरादा इरादा कर लिया हमने देश से अपने ये वादा कर लिया हमने।
एक पवित्र सी हवा बहेगी,
उज्जवल उज्जवल हो भारत,
कोना कोना निर्मल होगा,
विश्व कहेगा जय भारत।
जाग उठेंगे भाग्य हमारे, स्वच्छ बनेगा ये भारत।
स्वच्छ भारत का इरादा इरादा कर लिया हमने देश से अपने वादा ये वादा कर लिया हमने, ये वादा कर लिया हमने, ये वादा कर लिया हमने, ये वादा कर लिया हमने।
Sound of a stone being clinked on metal doors of bungalows. Shobha Bansode, a waste picker, has set up this innovative system in Prabhat Nagar, Pune. The residents will dispose of their waste, no doubt. But how will Shobha's day roll out? Will she suffer the indignity and the injury of unsegregated waste? Will she find her hands in contact with sanitary waste? Or will the residents spare her and segregate their waste? Pune generates about 1500 to 1600 metric tons of solid waste daily. Approximately 40% of this waste is collected from households, 25% from bulk generators such as hotels and restaurants, 25% from commercial establishments, and another 10% from food and vegetable markets. According to the Solid Waste Management Rules 2016, every single waste generator must segregate their waste into dry, wet, and sanitary. The rules explicitly state sanitary waste means wastes comprising of used diapers, sanitary towels or napkins, tampons, condoms, incontinence sheets and other similar waste.
Sanitary waste poses a health risk for the waste pickers who use bare hands, come to our homes to collect this waste. It poses a question of indignity for these people who come and collect the waste. Purely in clinical terms, body fluids such as blood, stool, urine, if you're coughing into tissues, all of this can carry microbes or pathogens or bugs. Some may die, but some may live long. And this poses a risk to the waste pickers who are collecting these items with their hands, as well as breathing close to all this waste.
To ensure that solid waste management rules are followed, the Pune Municipal Corporation or PMC works with its residents, waste pickers and civil society organizations. About 56% of the households under PMC are covered by door-to-door collection, and about half the households in the city segregate waste. Waste workers across India have been advocating for improved sanitary waste segregation in order to protect their health and dignity.
इतना इन लोग करना चाहिए, अलग से एक पन्नी में रखेगा तो हमारा आसान है, वो अलग से उठा के हम फेंक नहीं सकते, दूसरे कपड़े का साथ नहीं मिलेगा, अगर इन लोग होशियार होना चाहिए.
Their demands are: wrap up your sanitary waste properly, make sure it is given either separately or is easily recognizable, do not expect a waste collector to collect and handle sanitary waste thrown out carelessly. Waste workers wish for their dignity to be protected too. This is both a sensitive issue and a challenging one. Sensitive because discussing such types of waste has been taboo, and challenging because ensuring the waste generators are segregating waste, which itself is a challenge. Swachh campaigns for segregated sanitary waste from all those who give them their waste. Pune's plea asks waste generators to simply wrap and separately dispose of sanitary waste. The residents of Pune are actually being asked to do something much easier than the citizens of Bengaluru, who are expected to segregate all sanitary waste and leave it in a red bin as part of the 2-bin 1-bag system.
The first step to any management of waste is segregation at source. Once mixed cannot be fixed. You see, if somebody were to mix their food waste with a sanitary napkin or a diaper, nobody would ever want to put their hand into it.
An on-ground challenge is to ensure that waste once segregated must be kept separated across the collection and transportation chain. While source segregation is key, training waste pickers is also important. In Pune, attending training is part of the work cycle. The training is not only about waste segregation, but more importantly, about delivering professional waste services. The earnings of Swachh members are generated through revenue from user fees collected from citizens and the sale of recyclable materials. The organization utilizes 5% of the user fee as administrative expenses. The municipality of Pune supports the administrative charge, infrastructure and equipment costs. The financial support from the PMC allows Swachh to pay professional salaries and supports positions that bring added value to the work. This includes extensive data collection, documentation and reporting. The PMC pays Swachh rupees 3 crores and 22 lakhs for 5 years.
सेग्रीगेशन करके कचरा आ जाएगा तो हम लोग को भी सेहत के लिए अच्छा रहता है, क्यों तो हम लोग को गंदगी के में हाथ नहीं डालना चाहिए। अभी सूखा मिलेगा अलग से तो हम लोग को वो गीले कचरे के अंदर हाथ नहीं डालना पड़ेगा। इसके लिए हम लोग सबको ऐसे भी देते संदेश कि हम लोग को गीला अलग से और सूखा अलग से दो। जो भी घर से मिक्स कचरा आ जाएगा तो वो लोग को हम लोग बोलते हैं कि मिक्स कचरा मत दो, हम लोग को अलग से दो। क्यों तो क्या अलग से कचरा देंगे गीला तो कंपोस्टिंग अच्छा तरह से हो जाती है। बोल के वो लोग नहीं सुनेंगे तो हम लोग उनके ही सामने वो कचरा अलग करते रहते हैं। जब तक वो लोग को मालूम नहीं होता है और वो लोग नहीं समझ जाते तब तक हम लोग उनके ही घर के सामने खड़े रह के वो अलग से करते हैं।
Sanitary waste cannot be handled without a larger system in place. It makes no sense to segregate waste if there is no plan to handle it well. The reason the city of Pune could even talk about segregation was because it had a plan in place for providing various streams of waste.
Reduce, reuse, recycle, recover. That is a 4R. Effective implementation of 4R is the major role in this activity, and integration of the informal sector, because initially there is a many waste picker they collect at community place, and where pigs and dogs, stray dogs and all these things, it's a dignity issue. And when we form the society with the help of Kagat Kaj Kashtakari Panchayat, it's a trade union, and they form the society, and PMC, Pune Municipal Corporation, has given the consent to them, and we authorize them to collect the door-to-door waste at source itself. And in this context, we provided bins, small bins having capacity 75 liter to each and every citizens, so that segregation level would be increased and people can segregate at their waste at their source itself.
On 24th August 2007, the PMC signed a memorandum of understanding with Swachh and entered into a public-private partnership. Today, Swachh provides door-to-door waste collection services to 4 lakh households in the city and covers 60% of the PMC's geographical area. The remaining 40% households are dependent on PMC's Ghanta trucks or community bins for disposal. Out of 144 municipal wards, 122 are covered by Swachh. Currently, a team of 2 waste pickers collect segregated waste from households and commercial establishments in separate bins using manual push carts. The waste collectors sort the dry waste in sheds provided by the PMC or in areas designated by the resident welfare associations and retrieve recyclables such as paper, glass and plastics. They retain the income from the sale of this material. The wet waste and non-recyclable dry waste is handed over to PMC's collection vehicles at designated spots. If sanitary waste comes into the waste stream, the waste pickers are forced to touch it, and this may cause damage to their health and hurt their dignity. Besides training and empowering waste workers, the PMC encourages citizens to treat waste at source. As an incentive, the corporation also provides a rebate of 5% on property tax to societies, institutes and commercial establishments that compost on site. Swachh members compost close to 10 tons of waste every day in 80 housing colonies across the city. But the challenge in Pune and in other parts of India remains. So what can be done with sanitary waste? Panaji, Goa's capital, is struggling with mounting sanitary waste. They have not come up with an effective way to treat this waste. Incineration is not an option for them as the Pollution Control Board is not giving them a go-ahead. The heaps of waste can hamper the sanitary conditions of the city.
Companies need to be encouraged that the amount of plastic in these sanitary pads and diapers need to be reduced, because with burning you release a lot of toxins, dioxins in the air, which again cause cancer. So the whole chain has to be looked at, and various players and their roles sort of need to be tightened. But at a household level, at least one can appeal to each of us, where we know and see this, that anybody picking up unwrapped sanitary pads is basic human indignity to the person who's handling them.
In a couple of sites, they've also added sanitary waste in aerobic composting facilities where temperatures rise very high. In many schools in India, mini incinerators are being installed to handle menstrual waste. However, the safety of these for public health is questionable. So the challenge remains for Pune. What can be done with the collected sanitary waste? As of now, it is being discarded in landfills.
We also have health hazards for the waste pickers. Like when you mix garbage, there is sometimes broken glass in it, there is blades in it, there is sanitary towels in it, what we call bio waste, so diapers, things like that. But when you so segregate it, it so happens that the waste picker doesn't have to sort through. I mean, the chances of her getting cut on a blade and catching an infection reduce. Health costs are a big part of anybody's life, and so there is a tangible health benefit to the waste picker. The new 2016 law says that you have to separate bio waste separately, but we are working on it. We are working towards educating people on it.
The PMC Swachh initiative has been able to divert 60 metric tons of waste away from landfills every day. PMC is committed to making Pune a zero landfill city. With the success of the initiative, PMC started a zero waste campaign in Katraj ward in collaboration with additional partners Janwani and Cummins India. This initiative has now expanded in 20 prabhags or electoral wards in the city. Such partnerships have allowed the PMC to put in place a simple, transparent and financially sustainable model of door-to-door waste collection and resource recovery at local level. The Solid Waste Management and Handling Rules of 2000 asked that waste be segregated into dry and wet waste. The rules further stipulates that sanitary waste be specially disposed as a unique category. Municipalities in India are working hard to streamline this waste and manage it more effectively without harming the environment. The PMC has worked with citizens and citizens groups to convince the waste generators of Pune to start shifting from the old rules to the new ones.